Okay, I thank you for this opportunity to address the Freeholder Board this evening. I'm sorry. My name is Barbara Egger. I'm president of the Health Professionals and Allied Employees Local 5112, that's HPAE. HPAE represents 12,000 nurses and health professionals across the state, including 70 registered nurses at Runnells Specialized Hospitals. The presentation by CHR to the Union County freeholders for the privatization and sale of Runnells Specialized Hospital was entirely focused on cost-saving measures without any proposals for improving patient care and the delivery of health services to Union County residents. Nor did it propose how to maintain accountability to taxpayers and protect the rights of nurses and healthcare workers. The continuing economic crisis in New Jersey has made an already turbulent healthcare environment more difficult. It appears the healthcare industry can appear to operate like Wall Street, chasing profits without proper oversight, accountability, or transparency, with high administrative salaries and unnecessary patronage jobs. Healthcare delivery has and is changing dramatically. Increasing for-profit owners, declining reimbursements, and the Affordable Care Act will create both challenges and opportunities for patients, governments, and the healthcare workforce. However, privatization of healthcare has not proven to be the answer. In fact, the reverse is true. Privatization has more often decreased access and quality of healthcare and created a decline in working conditions, wages, and retirement security of the healthcare workforce. At the same time, accountability and transparency to taxpayers is also diminished or lost entirely. Before Union County decides the fate of Runnells Specialized Hospital, I ask that you consider: has there been a financial assessment regarding the expansion of the psychiatric ward and the potential need, cost, and revenue? What would be the benefits of adding a geriatric psychiatric unit? What is the potential for adding an acute care psychiatric unit? Would the county consider using a portion of Runnells as an adult daycare facility for county residents? Middlesex and Monmouth counties have found a formula for not only making their county facilities profitable, but in fact are expanding their system. Has this board looked at what these counties are doing to protect patient services? What is the interest of CHR in actually buying or managing these facilities, and will they be excluded from bidding on the hospital since they've been a consultant? What factors will you use to decide the future of Runnells Hospital? Will you commit to protecting the working conditions and collective bargaining rights of the workforce? Will you commit to protecting access to care for Union County residents? I respectfully ask that before there is any further discussion regarding the sale of Runnells bed, license, or selling the entirety of the hospital, that you consider other methods of gaining revenue that will allow Runnells Specialized Hospital to remain open to the community and perhaps even expanding services. In addition, I welcome any member of the Union County community to have a conversation with me about the future of Runnells. I may be able to provide information that you have not previously considered and put a different slant on things. Not everything is about money. Thank you.
Chairman Carver, freeholders. My name is Guy Lightsey. I'm from Scotch Plains, New Jersey. I would like to expound upon what Ms. Barbara Egger just said. What we need is a solution to find jobs, not solutions to try to find cuts in all the departments, losing jobs. Without people not being able to work, you're hitting other people harder in taxes. And we need to find a solution to get jobs. The trend, going back into the early 1900s, when society was just developing and we were starting to find the automobile, computers, everything, when everything started to evolve, there was plenty of money. Now it's like things have peaked. All of a sudden, everybody's pockets are getting heavy and they don't want to give up the money. So now some people have to lose out. And these are the people, perhaps in Runnells, perhaps in other areas of the county, that are going to lose their jobs simply because we cannot find a solution to help create jobs and try to save jobs. We need to try to work together, extend to all the avenues, any avenue that's open to us, to try and see if there's a solution. Not just you yourselves, but utilize utilize the others that are out here trying to approach you to try to help us to maintain our jobs. Because we have families, we pay taxes. I've been a resident of Scotch Plains for 32 years. My kids have grown up. They graduated from Scotch Plains Fanwood High School, and I got grandkids now. But what's going to happen? What is their future going to be like if we keep cutting instead of trying to find a solution to make things work? I thank God I'm 62. I can file for Social Security, a little nest egg here and there. But what about my children, my grandkids? They still have to make it. Society seems to be designed to not allow you to get 25, 30 years on the job anymore, to get the medical benefits that you need in order to survive. I remember when I didn't have to make a co-payment. I just said, here's my card, and that was it. Today, co-pays are going up totally out of control, and as we age, we need a lot of medication, and I'm quite sure a few of you up there can agree with me. But this is where we're going. If we don't stop this negative trend and start thinking a little bit positive and trying to reverse this cycle, we're all going to go down, because not everybody can survive. When you talk about the jails, the prisons out here, we're their job. That's why they're there. If we don't do something to try to turn the young people around, get them more actively involved, get their mindset towards getting educated, learning a trade, learning something, but becoming someone. And this is where we're at. So I appeal to you all to try and think of a means of trying to turn this trend around instead of let's close this down, let's cut this, let's see how can we allow this to survive and prosper. This way the taxes won't be hurting everybody in Union County. I thank you for listening to me.
Mary Palisano, once again, Westfield. I urge you to consider the comments from Barbara Egger, because I don't think that financially things have been investigated and avenues have been explored to utilize the facility to the best for the taxpayers of Union County. I'm not up here imploring you to keep my job. I'm a nurse for 38 years. I can have a job tomorrow. I'm asking you to look towards your constituents, the people that you're representing. When you go to that facility, and I think some of the members have had their parents at that facility, you understand the type of care that the Union County residents receive. And when Josephine C., who's 99 years old, when I said to her, we may have to privatize the hospital, she started crying. She said, this is my home. You are my family. Where am I going to go? I mean, she sits there every day, 99, knitting outside of the cafeteria, knitting lap blankets for other patients and their families. She'll knit you, if you come up, she'll knit your grandson, granddaughter a hat, 99 years old. I mean, the patients there, that is their home. And I can tell you that I used to run a home health care agency. And after that, I worked in many different capacities. I also was a travel nurse, so I worked at many, many long-term care facilities throughout New Jersey. And I can unequivocally say that the care that the patients receive at Runnells is superior. And I can tell you that that's going to be in jeopardy if you don't at least consider other avenues other than privatizing the facility. Thank you.